Medical emergencies in confined spaces. Every employee involved in confined space operations must be aware of potential medical emergencies that might arise, and the course of action to follow if they do. Let us discuss some common medical emergencies that may arise during work operations in a confined space. Heart attacks are one of the prime killers of workers on the job. Symptoms include chest pain, weakness, shortness of breath, and nausea. While the onset of these symptoms usually occurs quite rapidly, any indication of chest pain should be treated seriously. Asphyxiation occurs when the body is deprived of oxygen. The two most common causes of asphyxiation in confined spaces involve engulfment and entering an oxygen-deficient atmosphere without appropriate respiratory equipment. Symptoms of asphyxiation include a bluish tinge to the skin and unconsciousness. If entrants inhale a toxic chemical, they may suffer acute effects, including shortness of breath or even asphyxiation. Burns in a confined space may range from the smallest burn on a finger to a whole-body burn, caused by an explosion or fire. While minor burns may be easily treated on-site, major burns are catastrophic and require immediate medical attention. It is important to note that respiratory complications are common in confined space fire victims. The victim should be kept warm, but ointments should never be applied to significant burns. Fractures are common injuries in confined spaces, and the construction industry in general. When fractures occur, the employee's body or affected body part should be immobilized before evacuation, if possible. Most of the time, fractures are not life-threatening injuries, but if the person suffered the fracture as the result of a fall, they should be evaluated for other, more serious, injuries. Like burns, lacerations can be both minor or major injuries, depending on the severity of the cut. With any type of laceration, there is concern for the amount of blood lost, the potential for infection, and the risk of exposure to contaminated blood for the medical or rescue team. Entrants into a confined space are at an increased risk of heat illness, such as heat stress, heat exhaustion, and heat stroke. This is because of the hot and humid environment inside the confined space, coupled with any bulky personal protective equipment that the entrants may be clad in. When a worker's core body temperature rises too high, they must be evacuated from the space and cooled while awaiting emergency medical services. If early signs and symptoms of heat illness are ignored, it could lead to coma, brain damage, or even death. Some of the medical emergencies we have discussed can be prevented by medically screening employees before they are allowed to work in confined spaces. Accidents can also be minimized by adhering to the procedures indicated in the entry permit. However, if and when injuries or hazardous material exposures occur, the entire workspace must be evacuated, and the attendant must summon emergency services. Any medical emergency experienced by a worker in a confined space should be assumed to have been caused by changing conditions in the space, until proven otherwise. Before any first aid is administered to the worker experiencing a medical problem, they should be evacuated from the confined space, if possible. If rescue teams must enter the confined space to assist in evacuation, they may first need to stabilize the victim using first aid. After first aid, the victim must be packaged for removal from the space. Packaging may involve devices like full-body harnesses, basket litters, or wristlets, in order to secure the body and remove it from the space without any additional injury. If the victim's injury is due to atmospheric contamination, removal of the victim from the space may take priority above everything else, including medical stabilization before removal.